attacks and other heart problems. However, its maker, GlaxoSmithKline, says several trials show that it is safe, and Food and Drug Administration Advisory Panel could vote this week to remove the drug from the market. Also this week, the FDA will review one of 3 new diet drugs that may soon be on the market. Joining us now, Dr. Scott Kahan from the George Washington University Weight Management Program to talk about the possibility or promise of some new drugs. Good morning to you.
Good morning.
Now, let me ask you, when patients come to you as a medical doctor, these diet pills, is there any diet pill out there that you would just say, hey, yeah, sure, that's okay, try that one, or is conventional wisdom still hold diet and exercise?
It's a combination. So we have a number of drugs already, some that have been FDA approved specifically for weight loss, others that are used for other purposes but have weight loss properties. And they're useful for some patients. Now, no drug is going to be useful specifically on its own. It needs to be in combination with a healthful diet and exercise, but it can be a useful tool in addition to a healthful lifestyle.
Before we talk about these 3 new ones, the problem seems to be the side effects. Some of them we saw with fen-phen years back could potentially be deadly. Is that basically the problem with some diet drugs out there?
That's part of the problem. So certainly with any drug, whether a weight loss drug or any other drug, there are side effects. Even with vitamins, there are side effects.
Sure.
So that's part of the problem. We need to find a drug in which the benefits outweigh the risks. And we have a few of them, although they're not off the charts wonderful. They have some good effect, but not wonderful effects. The new ones that are coming out seem to be more effective and seem to have fairly low rates of side effects. Now that said, we tend to look at a society at these drugs differently from other drugs. For example, we expect side effects when we're looking at a cholesterol drug or a blood pressure drug, but when we look at weight drugs, we think a little bit differently. We expect it to be effective without any side effects at all, and I think that's unrealistic.
Sure.
And if that's the way that we're going to look at it, if that's the way that the FDA is going to assess it, then it's unlikely to move forward.
Let's look at them. If the producer wouldn't mind starting over again with the full screens, if we can show the viewer at home. Qnexa, that's one that's coming out. 2 of them, they combine different existing drugs, and side effects aren't side effects are perhaps worrying, some say, and then there's one that's less effective but less side effects. Qnexa, we're saying patients lost between 13 and 15% of body weight. Side effects, though, memory, concentration problems. And then with the other one, is it Contrave?
Yeah.
Contrave, patients lost between 5 to 10% of body weight. Side effects, nausea, not as troubling perhaps. Anything to add about those 2?
So with both of these medications, they're combinations of existing medications, and we've used those medications for weight loss for some time now. And it's true, there certainly are some side effects, and in some people that keeps them from using them, and in some people we have to go at very low doses in which they're not particularly effective. Sure. But for other people, they're quite effective, again, as a tool in addition to a healthy lifestyle. And that's probably going to be how it is with these. Now, in combination, and in the combinations that they use, which are sustained release and in lower doses, they're probably going to be better tolerated. They're probably going to be able to be used by more people who need them, but there are going to be a number of people that don't tolerate some of the side effects, whether it's a little bit of tingling or some nausea or difficulty sleeping, things like that.
The third one is lorcaserin?
Lorcaserin, yeah.
And if we could show the viewer at home just basically the bullet points of this new drug. First of its kind, they say acts on serotonin receptors. We've heard a lot about that. And the patients lost 5% of the body weight. There is where the results are a little bit lower, but less side effects.
True. Not quite as good results as the other 2, lower in terms of side effects, but again, it's just one other potential tool. It's going to be useful for some people and not others, and in some people they're going to see much greater than 5% weight loss. Other people won't see nearly as much. Do
you expect the FDA to pass these 3 drugs?
The first one that FDA is looking at this week, I'm hopeful. We've used these drugs for a while. Okay. We know the side effects. The studies are quite positive, so I'm pretty hopeful with that one. The other 2, one I believe the FDA is looking at in September, the other in December. I'm pretty positive about those as well, although I know a little bit less about those because less of the data has been shown.
Okay. Dr. Scott Kahan with the latest on these 3 diet pills being rolled out over time. George Washington University Weight Management is where Dr. Kahan is from. Thanks for joining us.
Thank you very much.
Steve, over to you.
Allison, thank you.
On the Hill, hearing to look at the safety and the future of